Most people have seen the video of Barack Obama where he is talking, and it was many years ago, talking about how all you have to do is pour enough raw sewage into society, enough doubt, create enough people questioning, and you will cause an entire country to no longer trust the system. And that's what Barack Obama wants people to do. That could be confusing to people because they may think, well, this could all be lies. Because if there were people that wanted us to doubt the system, they'd want all of the American people to doubt the system. But if you have discernment, you know what's true. You've looked into things, you know what's true and what's not. That said, what Barack Obama wanted, what the globalists want, what the socialists want, is for you to doubt the Constitution. They need you to doubt it, because if you doubt it, then it means everybody demands for something else to come in, a different system. And who will be bringing you that new system? Well, all those globalists and socialists will. Yeah, and they already have brought their system in. Quite frankly, we've not been operating properly under the Constitution because we shouldn't have so many three-letter agencies. We should not have, then on top of those three-letter agencies that are tied to the government at the federal level, they have these arms of associations, whether in science, education, medicine, nursing, hospitals, and then they become the dictators. So, I've said for a long time that how can you do anything about the private organizations? Because the private organizations, well, they get all the constitutional protection because the federal government can't legally tell them that they can't do this and they can't do that. And I've said that needs to change. The people that are in more powerful positions like that are heading, that are, billionaires running healthcare, running science in the university, there should be more regulations on, not just regulations, there should be more penalties, quick, swift penalties legally on them for violating others' constitutional rights. So you and I are supposed to be afforded those constitutional rights as well, right? But really, we haven't been. It depends on what kind of, industry you work in. But most people worked for an organization that said, no, in order for you to work here, you have to get these vaccines. You have to do this. You have to do that. You have to tolerate working in our unsafe system. And if you report it, well, it's not going to get anywhere because it won't. Because OSHA, all of it is tied to the same corrupt system. It's been polluted. But your constitutional rights have been violated, and no organization, I don't care if it's a hospital, I don't care if it's a freestanding psych facility, I don't care if it's a chief nursing officer that shouldn't have a license anymore because she wants to justify leaving her staff and patients in unsafe situations. People should be held legally accountable for that behavior. The reason they're not is because we have a credentialing board that is tied to globalism. So the Constitution is a strong document and it can stand. That's not what needs to be thrown out here. It's everything that came in that has destroyed, that's tried to destroy the Constitution and our constitutional rights with it, that needs to be eliminated. So don't go as far as believing the Constitution is no good. It is. It just needs to be enacted the way that it should be. And a lot of agencies need to be eliminated. And by eliminating them, you can hopefully get rid of these associations that are dictating care, especially in healthcare. I tried to look up, because at least the way I was taught in nursing is that nurses are supposed to be strong advocates and do the right thing. It's about honesty. It's about safety. And it's pissed me off for years that, and it's not all chief nursing officers, it's not, but most of them They are going to go along with the organization. And yes, if that's your employer, you need to do that. But when you actively should know that, no, this is a safety crisis, I'm putting staff in harm's way, I'm putting patients in harm's way, patients aren't getting any therapeutic value, then you should be a chief nursing officer that says, how much do I want to bend over for the organization? Because if you want to have a respectful profession, then you need to be a nurse. That I get that you may not be able to change your organization, but then you can change yourself and make sure that you're going to be on the unit taking a handful of patients every single day, or else you should leave your positions. Because just going along with those corrupt organizations, and they are corrupt, all of them, is not the answer. I tried to look into any peer-reviewed articles about chief nursing officers, and everything, talk about the monopolization of hospitals. All of nursing has been monopolized, and it's through the UN. Nursing Journal World, American Nursing World, American Nurses Association, National Nurses Union, all of it tied to one organization, which everything they put out as far as best practices for nurses all comes out from a handful pool of people. That's not being objective. Just because they say it doesn't mean it's the best practices. We do not have best practices right now. If we did, during COVID, there would have been more healthcare professionals questioning, why are we still using remdesivir after seeing so many poor outcomes? There used to be a time before the monopolization of everything where healthcare workers were taught that you do question those things. And doctors could have easily said, no, let's scratch this. That was before the monopolization and globalization of healthcare came in. So there needs to be accountability. The leadership in nursing needs to be held accountable for not doing what their profession calls them to do. You can't always just put it on the frontline workers. The other thing is these people, and this has gone on for years, there is people that are watching video cameras from their home. There is. I mean, they'll tell you, they're not shy about it. In these freestanding psych hospitals, but they do it in hospitals too. They'll have their security be able to log into their computer and look into wherever cameras are. And if any patients, and in some places they have cameras in the rooms, that's a HIPAA violation. I don't care if it's some safe modem or some safe internet connection. Nobody knows who's in that home. Whoever's watching that computer, their husband, their wife, their children, could be seeing that patient while you're, being a little creep or checking up on everybody. They're very open about doing this in their home, logging into these cameras. This is a total HIPAA violation. And something needs to be done. Now, of course, nothing will be done about it until the corrupt system in Washington is gutted out. Then something will be done about it, in my opinion. Something can be done about it. But we would never get to this point had we stuck within the Constitution, and that's it. We all play a role in not realizing that, no, the Constitution was lost a long time ago with experts and associations and monopolies that have now controlled all the major industries. And you can't trust them. The only way to bring trust back into them is, again, leadership at levels of senior leadership need to be held accountable. The private organizations themselves need to be held accountable. Whether it's cutting Medicare, I don't know, something. But the Constitution itself, that's a strong document. You don't want to get rid of that. That's the one protection against these globalists. They want you to give up on the Constitution. Brilliant men wrote it. It's strong, and it's what will protect us. And in the end, it's what will take care of all of these globalists.